Hey, my name is Kara. I'm an ultrasound tech, and let's talk today about the most common type of congenital heart abnormality that we see on baby in utero, and that is a ventricular septal defect, or VSD for short. Now, this is where there is a hole that is between the two ventricles in the heart, so between the right ventricle, which pumps blood out to the lungs after baby is born, and between the left ventricle, which is in charge of pumping blood out to the baby's body. Now, in this type of defect, when baby is just in utero, it doesn't often cause a whole lot of issues because the pressures in the right ventricle and the left ventricle are quite equal. So there's not any issues when that is the case. But after baby is born, these pressures then start to be very different. And that is where there are issues such as heart failure if the defect is big and it is not treated. Now, most of these defects that are small will actually just close up on their own and won't cause baby any sort of lasting symptoms. But as I said, when they are big, they do need to be repaired with surgery within the first few weeks to the first few months of baby's life. And if it is not repaired, unfortunately, baby will end up having heart failure or failure to thrive, basically all these things that are not obviously good for baby. Most heart defects are going to be caught at the anatomy exam when we are doing all of our heart views. And if this abnormality is seen during the anatomy scan, then we are going to refer mom to high risk, and she will end up having a fetal echo. And that fetal echo is going to look at the heart in many more views and just check the pressures and just make sure that there are no other defects. And mom will also end up having many more appointments because then she will end up being high risk because of a heart abnormality that is seen on baby. Usually, these kinds of heart defects are just spontaneous, as in there is no real known cause and they just spontaneously occur. And they are also not genetic in nature. But with that being said, there are also some cases in which a VSD or other heart defects are definitely linked to chromosomal abnormalities, and therefore in subsequent pregnancies, mom will have a higher risk of having a baby with these kind of defects. But again, this is something good to talk to your doctor about if you have been diagnosed with a baby having some sort of heart defect, and just talk to them about why this occurred and if there is any sort of risk in the future for having another baby with a heart defect of a similar nature. So I found these pictures online, which I thought were really helpful in illustrating what a VSD actually is. So as you can see here, this is going to be a normal newborn heart here. This is the right side of the heart, that is the left side of the heart. So again, this right side is going to be pumping to baby's lungs, and that other side, the left side, is going to be pumping out to baby's body. So like I said earlier on in this video, usually this defect is not going to cause baby any issues when it is still in utero because the pressures from the right side and the left side are quite similar when baby is still in utero. But it is when baby is then born that these pressures end up being different, and that's when problems start to arise. This picture is showing a VSD on baby. So although this VSD, which is kind of that hole right there in the middle of that separation between the right ventricle and the left ventricle, the VSD can actually be anywhere along that septum, and it can also vary in size as well. So it can be really big or it can be really small. So this hole in baby's heart is actually going to allow blood to mix between the two ventricles. And again, this isn't a big issue before baby is born because the pressures on both sides are quite equal. But after baby is born, as in right after baby is born, the pressure that used to be quite high in the lungs is actually going to start to decrease right after baby is born, as well as in the first few months of life. What this then means is that this right ventricle, which is going to be pumping blood out to baby's lungs, is going to have less resistance, while the left side, which is going to be higher pressure, is pumping blood out to baby's body. This is going to be an issue when we have a path that is less resistant, as in with this right ventricle here, it is going to be pumping blood out to the lungs again. That is now going to be less pressure than when this left ventricle is pumping it out to the body. So the blood is going to take the easier way out. It's not going to go down this way into baby's body because that is more resistant than if it just went over that way into the right ventricle through the hole. Now, this is going to be an issue because the heart is actually going to be working much harder than if that hole wasn't there, because of that extra blood that needs to pump out to the body that it actually lost over to the right ventricle over there because of the hole. So when this hole in the heart is small, usually baby doesn't have any symptoms, and again, it does close on its own in most cases, and there won't be any sort of further complications. But when it is a large defect, then the heart will compensate for a little while, but eventually it will end up working so hard that it can't compensate anymore. And that is when baby starts to develop symptoms such as really heavy and fast breathing, failure to thrive, and even heart failure if this is not caught early on and addressed correctly and the hole is big enough. So with these babies that actually have that larger hole in the heart, then it definitely does need to be addressed as soon as possible to prevent that heart failure. And surgery will be needed to close up that hole in the heart. Here you can again see that there is that hole in the heart over there between the septum of the right ventricle and the left ventricle. But then after surgery, we see that they have closed this hole in the heart with that VSD patch, and therefore the blood is not going to keep taking that path of least resistance over to the right ventricle from the left ventricle, and therefore we are not going to overload the heart and cause baby to go into heart failure. And lastly, for this video, I thought it would also be good for us to take a look at what a VSD looks like on a actual ultrasound. And hopefully you guys can appreciate in each one of these pictures that over here you can see this is where the hole is. So this is actually called an inlet VSD. Here is a muscular VSD, so right over there, and these are essentially just all different locations for different types of VSDs. And lastly, we can also see the defect, again, over here that is between the right and left ventricle, just like you saw for the other two. Hopefully this video has been helpful and you guys can see why a large VSD will be an issue for baby if it is not treated surgically, and also if it's not caught early on with ultrasound so that interventions can be planned out accordingly. But again, if it is a small VSD like the original commenter did say that her baby had, the prognosis is usually very good and surgery is often not needed because those kinds end up closing on their own and also don't often end up affecting baby with any sort of symptoms either because they're so small.